So if I have recommended penile prosthesis surgery and we've decided that this is the right treatment option for you together, my office will go through the standard preoperative instructions. Typically, this involves the standard recommendations for any surgery, which is to not eat or drink 8 hours before surgery, as well as some of the things that are more specific for this procedure. My preference is to have the patients use an antibacterial soap the night before surgery. You will get information about this. We do not recommend shaving the area since this can increase the chances of infection. Using clippers or some of the hair removal creams is okay, and we will go over that with you specifically. I also like to give patients, and this is a personal preference, the antibiotics before surgery. We, of course, give perioperative antibiotics at the hospital intravenously, but I like the patients to take antibiotics the day before and the day of surgery as well to have an extra layer of protection in case the timing of the intravenous antibiotics at the hospital is not absolutely optimal. This, I find, is something that has helped the patients. And we also avoid using aspirin or the non-steroidal anti-inflammatory medications for 7 to 10 days before surgery because this can increase the chance of bleeding. Tylenol is okay, so I tell patients if you have headaches, you want to take Tylenol, fine, but please avoid aspirin and the other class of medications that I mentioned. So if you've been scheduled for penile implant surgery, typically the office will contact you or the hospital will contact you about your arrival time at the hospital, which will typically be at least an hour before the procedure. You've been informed not to eat or drink 8 hours before surgery. Anesthesia team will see you. They will do their part. Then they will go through and we will go through our informed consent process. You may see some of our residents. They work with us, so don't worry that you're not seeing me per se in the pre-op holding area, for example. But then you're brought to the operating room. The team does what we call a timeout. We make sure that we have everything that we need in the room, that you are the patient that is scheduled for the procedure. So they do all those standard steps in the OR, and after the timeout is completed and anesthesia is given, then I do my part, the surgical part of, putting the cylinders in, putting the pump in, putting the reservoir in, and typically in most cases, the actual surgery is under an hour. Of course, the redo cases can take longer than that. And then you're woken up from anesthesia, taken to the recovery room. A group of our patients are kept overnight and some are sent home. Again, this depends partly on the individual patient and other medical issues that may be involved, as well as the insurances. Some allow staying overnight and some don't. I like to put a catheter in the urethra, so the patient has a catheter. You'll wake up with what we call a Foley catheter that drains the bladder. The main reason I like doing this is that because of the effects of anesthesia and some of the swelling of the tissues that can happen soon after the surgery, a small number of patients can go into what we call urinary retention, and you really do not want someone to come and put a catheter in when you're awake. So it's much better to have a catheter draining the bladder. This comes out early in the morning the next day. And there's also a drain in most cases that will come out the next day. And then you will go home with a new bandage and dressing and instructions for follow-up. The typical stay for this surgery is either overnight, or you can go home after the surgery and come back the next day for catheter removal and drain removal. So the typical patients will not need any kind of special clearance before surgery, but of course many of our patients do have other medical conditions and specifically some have heart conditions that lead me to recommend a cardiac clearance where they will see a cardiologist who will tell us that from their standpoint, from a medical standpoint, it is okay for us to proceed with surgery. Other patients, depending on their specific medical problems, may need to be referred, let's say, to their internist or their endocrinologist or whatnot, just to be sure that the team as a whole is on the same page, and so we will coordinate our efforts. I always tell patients that you should arrange for transportation, because even if you are staying overnight and going home the next day, the chances are that you have received some pain medications, so you really are not in a position to drive, and therefore transportation arrangement is a must. The typical instructions before the procedure are shared with you in the office, but I prefer to have patients use a vacuum device if at all possible for 4 to 8 weeks before surgery. This has been shown to minimize the chances of any length loss and possibly actually some length gain. I think this is a good practice, especially in those rare repeat penile implant cases. I like the patients to take oral antibiotics before surgery. This builds levels, and in case the intravenous antibiotic administration at the hospital is running slightly behind, it will add another layer of protection. In my practice, this is not necessarily standard of care that everyone follows, but we have found it to be very effective in minimizing any infections. I also like the patients to use a Hibiclens antibiotic wash the night before surgery in the area of surgery, and instruct the patients to use clippers or hair removal creams prior to surgery. We do not recommend, in fact, we recommend against using any kind of razor, because this will increase the chance of infection. The hair removal creams can be used, but again, I'll go through the details of when this should be done to minimize any irritation to the area and do it in a safe way. Typically, the only group of medications that the patients need to modify or stop before a penile implant surgery are blood thinners, because obviously these can increase the chance of bleeding, and I typically coordinate this with your internist or hematologist, whoever may have prescribed this. Most patients who are on other medications, let's say for their blood pressure, can take them with a small sip of water on the morning of surgery. Those patients who are on oral hypoglycemic, so if you're taking drugs to manage your diabetes, and this is in the form of a pill, those we will ask you to hold on the morning of, because since you haven't eaten 8 hours before surgery, if you take those medications, it could drop your blood sugar too much and it can be dangerous. But again, we will go over this in more detail in person. There are no specific eating or drinking restrictions that you need to follow before surgery, other than the fact that 8 hours prior to the surgical time, we do not want you to eat or drink any fluids. But let's say the day before, you could have your normal diet, and there's no need to change any of that. So we know that in modern day, there could be delays in starting the case before you may have taken longer, they may have anesthesia issues, nursing issues. So I always recommend bringing a book. Of course, if you have your phone, you could use your apps to read whatever you want. And this is always helpful advice on the day of surgery so you don't get bored. One of the most important pieces of advice that I give my patients is do not get tempted to shave before surgery. This has been shown to increase the chance of infections. Using clippers is okay. I also tell patients that if they want to use hair removal creams 7 to 8 days before surgery, that is okay. Typically what I tell them is to apply it to their elbows just to make sure that they don't have an allergy to it. And then whatever the instructions are on the particular cream that they are using, I would say use it for a slightly shorter period because it could cause some irritation. And if you do see burning or rash on the elbow when you test it, then do not use it and you could just use clippers. So it is completely normal to be nervous about this. After all, it is surgery and it is a very intimate and sensitive part of our bodies. But what I can tell you is that you are in good hands. I've done this procedure thousands of times over the last 25 years. I have lectured on this. I have worked with residents and other surgeons to train them. For many years, even when other surgeons have had problems with their initial cases, I've been a referral source for those more complicated procedures. And of course, I will always give it my absolute best. So you need to know that not only I bring my expertise to the table and work with a fantastic team, but also the rest of the team and the medical center are as good as it gets with absolute care as well as state-of-the-art equipment and abilities. You will of course have many opportunities to ask questions directly from me, and I pride myself in being very available. So you can call the office, leave a message with my staff for me. I will either reach out to you directly if the problem is something that requires my personal attention, or the office staff who have experience dealing with similar issues may be able to address your concerns. But either way, if you have questions, never ever hesitate to reach out, and somebody, including myself, will definitely reach out to you.